the three routes of our injections that would be present on the treatment sheets would be subcutaneous, intramuscular, or intravenous. At least when I'm on clinics with the house officers, we try not to do an IV injection if there's no catheter that's present. And I do think at maybe a different lab, we'll go over like how to place an IV catheter and then probably like acquire blood. So maybe I won't talk about that one right now, but I think most commonly you'd be giving a subcutaneous injection or an intramuscular injection. Subcutaneous injection, you find any little loose bit of skin and you make a little triangle, and usually if this is my syringe and the purple cap is the needle, I'll want to point the needle going down towards the ground. That way, if the goat jumps up, they jump up onto the needle, and then you can aspirate back, see if you get air. If you get blood, pull out and redirect. But if you don't get blood, then you can deposit the substance in there. I think the easiest places to give subcutaneous injections are going to be right on their neck, right in their cervical region, and I'll show you when we go in there, I'll pull their skin out. They also have a hairless area, their armpit. That's another spot, like a big target for where you can give a sub-Q injection. I think that spot tends to be more sensitive than regions on the neck, and when you're holding the goat by the horns, it's just easier if you're by yourself to give the sub-Q injection or your partner to come over and give the sub-Q injection. For an intramuscular injection, we really only administer that medication in the cervical region. We do not typically do any injections in their booty because we do not want to harm their sciatic nerve. Again, most of these animals are pets, but if they were a meat-producing breed, then we could also injure the meat, the muscle that's back there, and that would lower the quality of the product for the owner. So, in the cervical region, do you guys remember what your landmarks are? Tell me. Okay. Yeah, you got it. So it was the cranial border of the scapula, the nuchal ligament, and then the transverse processes of the cervical vertebrae. So it forms a nice little meaty triangle where, again, if this is going to be the needle, I'm going to push it in directly, like perpendicular to the goat, right into that muscle area, and then aspirate back to make sure there's no blood. If there is blood, I usually just come all the way out, and then I'll find a different spot to poke. If there is no blood, then you can deposit that medication there. And these species, you really should not deposit more than like 5 to 7 mils in one injection site. I can't think of a drug that would have a larger volume than that for any of our goats, but if there was something that was greater than 7 milliliters, I would probably break that up into 2 injection sites. That way we would decrease the maybe prevalence of like an injection site reaction that's present there.
What size needle do you recommend?
For most goats, these adult goats here, I'd probably use a short 18 gauge needle, so like a 1 inch 18 gauge needle for intramuscular or subcutaneous, yeah. If we have like a real beefy, so like Neo, who was in the hospital a few weeks ago, she was a pretty stocky doe. I think the 1 inch worked fine on her, but like if I had a buck or a ram that was there, maybe I'd want a 1.5 inch 18 gauge needle. For the neonates, I'd probably want to use a smaller needle. I think like the 22 or the 20 gauge, is that like the pink and the blue up there? Yeah. I would probably recommend using that and the 1 inch needle too. And for them, if you're giving an intramuscular injection, you may not go in the whole length of that 1 inch needle, right? Like it might only be half of that 1 inch needle. You really have to use your discretion as you're palpating. Aside from the cervical region, one other potential location for an intramuscular injection would be their triceps. An example would be if we had a goat in the hospital that was attacked by a dog and they had a whole bunch of lacerations along their neck, you might be hesitant to put an injection in their neck muscles there because you could increase their chance of developing like diffuse infection right there or spreading the infection throughout the muscle. So you can try to isolate their triceps, which is just going to be on the back of the forelimb, And if you their triceps is so well defined that you can usually just hold it in place and then inject the needle right above where your hand is. So if you were to do a triceps IM injection, I definitely would have like a partner there to help hold the goat. For some of the goats in the clinic, for some of these animals here, you can do the sub-Q injection or the eye injection yourself. But if you ever, it's never wrong to want someone to come and help hold the animal for you. It's safer for the animal, and it's safer for you, so you don't get hurt as you're going to coat that animal. But some critters, you are able to do that by yourself.
As far as blood draw goes, on some of these, like either neonate or like the really like parasitic load young goats, other than jugular, are you okay with getting, if we're checking glucose from the ear?
Yeah, that's a good question. And maybe that varies per clinician. I don't trust ear samples. I've seen huge differences in glucose between the ear and what you acquire from like the non-catheterized jugular vein, or even the tail in cattle, because that part of the body, like, they're not going to care about in a very diseased state. Does that make sense? There's no paper that like supports that, and that's one of the clinical trials we want to do, but to me, I don't like ear samples or ear pricks for a blood glucose.
Okay.
I don't know how I feel about like a cephalic vein, because that's already just really challenging to get in our ruminant species. I know it's so easy in dogs and cats, but it's really challenging in goats. So maybe that would be more accurate than an ear, but way more challenging to acquire. We have put catheters in cephalic veins or saphenous veins in the past, but those need to be monitored super closely because they're much more likely for the catheter to pop out and that vessel to blow. And then if the fluid pump does not alarm you that there's an abnormality there, or you're not maybe checking as effectively, I've had patients that we've lost for life because they've had so much fluid pool up in that way. So we tend not to use those. And I know, like, in horses, don't they do like the lateral thoracic?
You can, yeah.
Yeah, I've never done that on a large or small ruminant. I don't even know where that's located. So